Good day to all. My name is Fujin, and I'm from Group 6, along with my team members, Kalok, Yihan, Sengcho, and Junfei. Our presentation today will be based on a case study about a 3-year-old boy who was admitted to the hospital after experiencing several symptoms. A 3-year-old boy was admitted to the hospital with a fever at 29 degrees Celsius, belly pain, diarrhea, and vomiting. He was given intravenous fluid for hydration. Based on the patient's history, none of his family members had developed similar signs or symptoms. He had no pets at home, but 2 days ago, he travelled to a petting zoo and had physical contact with some of the animals. His stool sample is further obtained as yellowish loose stools with streaks of blood. Laboratory findings showed that his blood contains elevated neutrophil levels at 9.2 times 109 per liter and an increased C-reactive protein level. The boy was then tested negative for COVID-19 infection.
Thanks, Fujin. I'm Carlo, and I will talk about some questions that will be asked in order to understand well with the conditions of the kids. First of all, what other symptoms besides fever, stomach discomfort, diarrhea, and vomiting are the patient displaying? Additional symptoms could offer hints as to be conditions underlying diagnosis. For instance, a sore throat may indicate a viral illness rather than a bacterial infection in the patient. Secondly, how long have the patient's symptoms been present? The length of the symptom can help assess the illness severity and direct the most suitable course of action. Lastly, has the patient recently taken any medications? This is because gastrointestinal symptom can be brought on by a number of treatments, including antibiotics and non-steroidal anti-inflammatory drugs. Next, I'll pass it on to Junfei to talk about the most probable diagnosis based on the case study. Thank you.
Gastroenteritis with bacterial infection is a potential diagnosis based on the patient's medical history and test results. Fever, stomach pain, diarrhea, and vomiting are typical symptoms of gastroenteritis. The presence of bloody streaks in the yellowish loose stool suggests that the colon or intestines may be inflamed. An infection, possibly bacterial in origin, is present in the body as shown by elevated neutrophil and C-reactive protein levels in the blood. The probability of a zoonotic illness is increased as the patient was exposed to animals at a petting zoo 2 days ago. Infections known as zoonotic illnesses are spread from animals to people. Salmonella, E. coli, Campylobacter, and other zoonotic bacterial diseases can all cause gastroenteritis. In order to determine the causal agent, it is crucial to gather a thorough history of animal contact and to carry out the proper diagnostic procedures. The negative COVID-19 test result eliminates the risk of COVID-19 infection, which in certain people can also result in fever and digestive problems. Hydration therapy and antibiotic therapy are frequently used as treatments for gastroenteritis caused by bacterial infection. Antibiotics should be provided if the stool culture shows that a bacterial infection is present. It's critical to keep an eye on the patient's symptoms and handle any side effects such as dehydration. Kalak will now talk about the pathogenesis and the causative.
Thank you, Junfei. I will talk about the causative agent and also explain about its pathogenesis. The causative agent involved is Escherichia coli 0157H7. Based on Cleveland Clinic, abdominal pain, diarrhea with blood, and vomiting are the common symptoms that are caused by this strain of E. coli. E. coli are commonly found in the surface of animal. Centers of Disease Control and Prevention also stated that touching the skin of animal may increase the risk of getting infected by this strain of E. coli, especially those with weak immunity such as children. The parents of the 3-year-old boy did not clean his hand properly, and the boy put his hand into his mouth, causing ingestion of this strain of E. coli, as children always like to put their hands into their mouth. Based on Amir, Wase, and Zelen, when E. coli 0157H7 is ingested, it will adhere to the intestinal surface by using fimbriate and release translocated intimin receptor onto the surface of the intestine cell. The bacteria will then bind onto the translocated intimin receptor through the intimin, which is a type of bacterial adhesion molecule expressed on the surface of bacteria. Binding onto the translocated intimin receptor allows the bacteria to attach firmly to the intestinal cell surface. The bacteria will then release a type of toxin known as Shiga toxin. The Shiga toxin release will damage the mucosa of the intestine and interfere with some protein synthesis. This will cause damage to the lining of the intestine and therefore cause bloody diarrhea. Inflammation will also be triggered, and this is the reason why neutrophil level, which is the white blood cell that fight against bacterial infection, in his blood increased. Besides that, Amir, Wase, and Selen also stated that the E. coli 0157H7 will hide in the cell to prevent being killed by the immune cell. This helps the bacteria to survive inside the host and continue to damage the whole cell. Furthermore, the bacteria can also invade the blood and cause systemic infection in some severe situations. Next, I will pass it on to Sengcho to talk about how to confirm our diagnosis. Thank you.
I'll be talking about the diagnostic methods which can be done to confirm the diagnosis. There are some traditional methods which includes traditional culturing methods and serology, and new methods which include mass spectrometry and PCR. Mass spectrometry can differentiate close strain species, and PCR can detect low amounts. These new methods are more accurate because they are more sensitive and specific. There are some other tests as well. For example, imaging tests like belly X-rays or ultrasound may assist in finding structural issues with the digestive system, which may cause the symptoms. Rapid antigen tests can detect the specific pathogens. PCR testing can quickly and accurately identify the genetic materials of pathogen in the stool sample. Blood could be examined to measure the white blood cells and C-reactive protein levels, which increased in bacterial infection. Stool culturing is the most traditional method and is usually the first test used to differentiate the possible diagnosis, as some species are unable to be isolated in some agar. The two agars often used in stool culturing are MCA and HE agar, and the combination of using these agar will clarify the identity with the color of the colonies displayed. In MCA, E. coli ferment lactose, therefore pink colonies will form, whereas for HE agar, E. coli will form yellow or orange colonies. However, further tests such as motility tests or biochemical tests are required to confirm the exact identity of the species. Motility tests can differentiate between the species according to their motility. For instance, E. coli is motile. Biochemical tests such as the TSI test will allow us to detect the ability of the species to produce gas, H2S, or produce acid. E. coli will turn the slant of the TSI agar into yellow due to the acid produced from fermenting lactose. Gas bubbles will also be observed, as E. coli is a gas-forming organism. Lastly, serology tests can help to identify the specific antigen associated with each of the pathogen. That's all from me. Next, I'll pass it on to Fujin to talk about the signs and symptoms.
Thank you, Daryl. The signs and symptoms of the patients may include dehydration, which is caused by diarrhea and vomiting, leading to dry mouth, dizziness, and decreased urine production. Also, other symptoms include appetite loss and weight loss, resulting in abdominal pain, nausea, and fatigue. Next, I will pass it on to Yihan to talk about the ways to manage and treat the patient.
Thanks, Sujin. Now I'm going to talk about the ways to manage and treat the patient. Firstly, the infected patient can be prescribed with a special rehydration drink made from sachets. It can be easily bought from pharmacies and drank if the patient has signs of dehydration, such as dry mouth and dark urine. This helps to replenish the loss of fluids and electrolytes, and patient may receive intravenous fluids or oral rehydration treatments as an alternative. Next, in order to treat bacterial infection, antibiotics may be recommended. The particular bacteria causing the infection and how sensitive that they are towards various medications will determine which drug should be used. Besides antiemetics and probiotics, these drugs can be used to prevent nausea and vomiting, allowing patients to continue drinking oral fluids. Live microorganisms known as probiotics can assist in re-establishing the proper balance of gut bacteria. Patients who experience cramping or stomach pain may find that over-the-counter painkillers like paracetamol are helpful. Finally, due to the potential of aggravating the digestive system, patients may be recommended to stay away from certain meals and drinks, notably those that are hot, fatty, or high in fiber. In some circumstances, a bland diet made up of simple-to-digest items such as rice, boiled potatoes, and bananas may be advised. On the other hand, ways to prevent gastroenteritis include maintaining excellent personal hygiene of regularly and thoroughly washing your hands with soap and water to stop the transmission of bacteria. This is especially critical before handling or consuming food and after coming in contact with animals. Next, cook food thoroughly. By killing harmful germs that can lead to gastroenteritis, cooking food thoroughly can assist. Meat, poultry, fish, and eggs must be all cooked in internal temperature. Drinking safe water also was proven to avoid waterborne illnesses. In addition, staying away from sick people also helped the spread of the germs. Last but not least, there are vaccines available for some types of bacteria that can cause gastroenteritis, including Shigella and Salmonella. It is crucial to consult a healthcare professional to find out whether immunization is advised. Thank you. As a conclusion or a take-home note, individuals are apt to practice a well personal hygiene in order to prevent the transmission of E. coli that will cause complications such as gastroenteritis. So here are the reference lists for our topic. And thank you for lending your ears for our presentation. Thank you.